Hello everyone, welcome. I'm introducing Tina Hoover, our infusion nurse, and I'm going to pull up the screen with her presentation on it and share it with you all. And let's see, we don't need this, but we do need this, and we need it to be big. And there we go. So I'm going to hand it over to Tina.
Thank you so much for taking the time to watch this presentation. I wish we could be together in person so that you could sense and feel the support that is here for you as you start your treatment. There is a lot of information to cover, and I have some good news for you. There is no test at the end of this presentation. This is a non-testing environment. Also, some other good news is that everything that I say is in your notebook that you have either already received or you will receive when you meet with your oncology doctor's nurse. So if you like to take notes, feel free, but like I said, there's a lot of information to cover and it can be a lot to write down. So just know that you'll be getting a notebook that lists everything that I say, plus a lot more good information. But one thing I would encourage you to do is if you have questions, do write down the questions because it can be easy to forget those questions, and we want to make sure that you get all of your questions answered. So let's get started. Today we're going to cover a little bit about what is chemotherapy, how to prepare for your treatment. We'll talk about side effects that might occur. We won't be taking the tour of the infusion clinic today, but we look forward to meeting when you do come in person. And then I'd like to spend most of the time talking about things that you can do to make yourself feel better during the treatment. Remember Captain Kirk from the Starship Enterprise and his continuing mission to explore strange new worlds, to seek out new civilizations, and to boldly go where no one has gone before. Well, you might feel like you have entered an entirely new universe. You have to seek out a new way of doing things during this part of your journey, and you might be feeling like you are going where you have never gone before. But the good news is that just like Captain Kirk had a crew to help him navigate these new explorations, you have a crew also, and that is us, your oncology crew. So make sure that you communicate with us, let us know what you need, tell us what's going on, and most importantly, remember that you are the captain of this ship. Sometimes it might feel like your spouse or your children or even your doctor all want you to make a certain decision, but we're your crew, and so we support what you want to do. Starting off, let's talk a little bit about how does chemotherapy work. So cancer is caused when cells grow out of control. Usually if there's something wrong with the cell will stop dividing, it will destroy itself because it knows that it's not working correctly. But cancer cells keep on dividing. Chemotherapy is medication that can destroy those fast-growing cells. And because cancer cells usually grow and divide faster than healthy cells, the chemotherapy destroys the cancer cells, but not all of the healthy cells. However, chemotherapy can also damage those fast-growing cells that are healthy, and that's what causes the side effects that we see from chemotherapy. But the good news is that we have a lot of new medications to treat those side effects that have been developed recently after years of study of how to make those side effects better for patients. We have a lot of things that we can do to make those side effects better. There are many different ways to take chemotherapy. It's not just through an IV. You can be taking an oral pill. You could be getting an injection either into the subcutaneous fat or into the muscle. We have a lot of other creative ways that we can give chemotherapy to a person. And oftentimes people will be getting their chemotherapy in more than one form. So you might be taking a pill and you might be coming in and getting an injection. And you also might be taking a different type of medication to treat your cancer. Newer developed treatments such as targeted therapies or immunotherapies, hormone therapy or gene therapy. These are not technically chemotherapy, but we usually lump them all together under the term chemotherapy just to keep it simple, and because we are using them to destroy the cancer. One thing that you will hear the oncology nurses talking about is cycles and days. The oncology doctor will order the type of chemotherapy to be used and the number of cycles to give you, and then there's a certain number of days in each cycle. Everybody's chemotherapy recipe or regimen or protocol is designed just for that person. So even if we're using a standard chemotherapy protocol, we will modify that protocol just for you so that you're getting the right dose that is safe for you. The oncologist, like I said, will often combine different kinds of treatment to get the maximum destruction of the cancer cells based on how your cancer is presenting. That's why two people can have the same diagnosis, breast cancer, for example, but be on different protocols, or even be on the same protocols, but have it nuanced just a little bit for just that person. If you're coming to see us at Infusion Therapy, that means that you're getting at least part of your chemotherapy through an IV or intravenous, and that's when we put it directly into your bloodstream using your veins. There's a couple of different ways that we can do that. There's pros and cons to each way. Your oncology doctors and nurses will discuss which way is best for you. And so let's just review those. The simplest way for us to gain access to your veins is just by starting a peripheral IV. This is an IV that goes in your lower forearm. We heat it up. Sometimes we can give you a little bit of numbing medicine, and then we just slide a needle into your vein and then take that needle out and leave a little cannula or a little plastic tube in your vein. The pros of this is that it's really quick and easy, and when we're done, we just take the IV out. Some of the cons are if you don't have a very good venous structure, if your veins have kind of been damaged already or they're difficult to access, then we really wouldn't want to rely on a peripheral IV. Also, it can depend on the type of chemotherapy that you are getting. Some of the chemotherapy is a little caustic or damaging to that very sensitive inner lining of your veins. And if you're getting one of those types of chemotherapy, we probably would not want to use a peripheral IV. So then we might go on to something else, like a PICC line. A PICC line stands for peripherally inserted central catheter. So it's like a very long IV. It's in your upper arm instead of in your lower forearm. And then the tip of the catheter sits right above your heart in a great big vessel, your superior vena cava. It's not in your heart, it's just sitting right above your heart. So the pros of a PICC line are that they can stay in for a really long time. So you don't have to have your vein accessed every single time that you come in. We can also sometimes do your blood draws through a PICC line. The other pro is that your veins don't get damaged by the chemotherapy because the PICC line is in such a big vessel that the chemotherapy doesn't even touch the inside lining of your veins. They are put in over at the main hospital by a specially trained registered nurse who uses an ultrasound machine to find the best vein to put it in. There's no anesthesia involved. They just numb up your arm a little bit so you don't feel it when it goes in. Another pro is that when you're all done with your PICC line, we just take them out for you at infusion. You don't feel it at all. It's a very simple procedure when we take out the PICC line. Some of the cons of the PICC line are, as you can see by the picture on your screen, you do have lumens or catheters, we call them, hanging out of your arm. And you can see that there's a dressing over the insertion site of the PICC line. That's because that area has to be kept sterile. And that means that you can't get it wet. So there's no swimming allowed. If you take a shower, you need to wrap it. No hot tubs and things like that. And if the dressing were to come loose, you would need to come in and get it changed. Even if the dressing doesn't come loose, you still come in once a week to get the dressing changed so that we can keep that sterile, so we can check out the PICC line and make sure it's doing okay. So even if your chemotherapy cycle, like I mentioned, is every 3 weeks, that means that on those weeks that you're not getting chemotherapy, you would still come in just to get your PICC dressing changed. It's a very short appointment. So those are the pros and cons of a PICC line. And if a PICC line or a peripheral IV is not the best choice for you, then we might move on to something called a port. Now, a port is also called a central line. Ports are put in a little bit differently. They are put in over at the main hospital in radiology by a radiologist. They do give you a little bit of anesthesia. You're not completely out, but you're just a little bit sleepy. And then they create a little pocket underneath your skin. In that pocket, they put a titanium septum or port. It's round. And in the middle of that port, there's some polymer, or it looks like plastic. And all of that goes underneath your skin. And then they attach a line to it, similar to the PICC line, that sits right above your heart, the tip of it. So that's why we call it a central line, because it's in your central venous system. And then they sew all of that back up. So after the port heals, you don't see anything because it's all underneath your skin. And that means that it's okay to get it wet and it's okay to go swimming. And after it heals, people usually don't even feel it. So some of the pros of a port is that it can stay in for a really long time. I think my longest port patient right now is at 9 years. She hasn't had treatment for that 9 years. She's only had treatment for 2 years, but she kept her port in. She just didn't want to go ahead and get it taken out. When your port stays in, you come in and get it rinsed monthly. So even if you're not going through treatment, you would still come in once a month to get your port rinsed out and filled with heparin, which is a little bit of an anticoagulant so blood clots don't form in that septum area of the port. We can use a port for labs. We can use it for all of the different types of chemotherapy. Some of the cons are, well, you do have to go over to the hospital to get it put in and taken out. And you do have to come in monthly, like I said, to get it rinsed. But we kind of see that as a pro because we like seeing our patients every month and seeing how they're doing and catching up on their lives. So those are all the different ways that we can gain access to your veins. There's some pictures on the screen for you of ports. As you can see by that picture in the upper left-hand corner, you can't really see it after it's all healed up. It might be tender at the very beginning, or there might be a little bit of swelling, but after that heals up, you don't even feel it when we access it. Okay, so when you're getting ready for chemotherapy, one thing we want to emphasize is that your oncology doctor is going to be taking care of your oncology treatment. So your oncology doctor is not going to take over the management of your thyroid, say, or of your diabetes or arthritis. So make sure that you have a primary care practitioner and make sure that your primary care doctor knows what's going on with you. It's very important that you discuss fertility with your oncology doctor. If you have any questions about fertility at this point, make sure that you call your doctor's office to get a chance to talk with the doctor about that. If you come to us on the first day asking about questions of fertility, we're not going to go ahead with your treatment until all of those questions are addressed. We do want you to get a digital thermometer and have it at home. That's kind of tricky right now with COVID, so make sure you give yourself plenty of time to find one. And I'll tell you why we want you to have that at home later. Just for the first couple treatments, we do like people to have a ride to and from their appointment. This is because, like any new medication that you get, we just want to make sure that you respond to it well with no hypersensitivity reaction. And also for a lot of the chemotherapies, we give pre-medications. Sometimes we give Benadryl, which can make people sleepy. And so we want them to have a ride home and not be too sleepy. And as always, please make a list of your questions or your concerns so we can answer them when you're here. Regarding your medication refills, it's really important that you don't wait until the medication is all gone before calling in a refill. Everybody should have anti-nausea medicine at home, 1 or 2 different kinds of anti-nausea medicine. We really don't want those to run out on you. We want you to have a supply at all times in case you need it. So don't wait until you're out of the medication to refill it. It usually takes a couple days to get it refilled. If you need a refill, just go ahead and call your pharmacy and they can process that for you. The only exception is if it's pain medication that has been prescribed by your oncology doctor. In that case, just call the office and talk to the medical assistant or the registered nurse, and they'll get that refill processed for you. Usually we allow 2 friends or family members to come back with each patient into infusion therapy. We like people to have that support with them right at the chair side. However, because of coronavirus, we are not having any visitors at all in the cancer center right now. As soon as it's safe, we'll go back to allowing those 2 visitors at a time. But just so you know, right now, don't plan on bringing anybody with you because there's no visitors allowed. This Infusion Day Checklist is listed in your binder, but just a couple of things I want to point out is that yes, we do want you to eat breakfast on the day of your appointment, or for example, lunch if your appointment is in the afternoon. You can bring entertainment, although the nurses are kind of entertaining to watch, but you can bring your own entertainment. Please bring headphones though if you're going to be listening to music or watching a movie, so that not everybody has to, you know, watch your movie or listen to that music. One thing I want to point out, if you do have a port, is please wear a button-down shirt. And that's because when we access your port, we actually create a 4-inch sterile field around the port. And as you can imagine, that's not very easy to do if someone has a t-shirt on. But if you have a button-down shirt on, we can just unbutton it and move it aside and then access your port and then button it right back up. Same thing if you have a PICC line, make sure that you're wearing the type of shirt that we could roll up the sleeve so that we have access to your PICC line so that we can really do a good job of changing that dressing. Also, if you don't have access to MyChart online, feel free to bring in your personal organizer, which is in your chemotherapy binder, and we'd be happy to write down your lab values for you so that you can keep a running track of them. One thing about the clinic is that we're an open clinic. That means that you'll be able to see other people in the clinic. You're not in your own private room, but we have chairs, and right now they're spread far apart to keep the social distancing. But still, we ask that you not bring in food that is really smelly, like onions and things like that, because some people's nausea can be triggered by those strong odors. So if you are going to have a long appointment, some people have appointments that take 10 hours. Some people's appointments are only an hour. But if you have a long appointment and you're going to be bringing in food to eat, which we encourage you to do, please just be careful when selecting that food so that it's not really stinky food. Also, we ask you to refrain from wearing strong smelling perfumes or colognes, because that can also trigger some people's nausea. And you'll notice that the nurses, we don't wear any kind of perfume. Thanks for doing that. And as I said, right now there are no visitors at Infusion Therapy, but even when we do allow visitors, we just want to let you know that although we love children, Infusion Therapy is not the best place for children. There's not a lot of space for them to be moving around. It's kind of dangerous to the nurses and the other patients if they were to trip over a child or drop something near a child. So it's okay to have children in for a quick visit as long as there's another adult that is watching that child. But other than a quick visit, Infusion Therapy is not the best place for children. Sometimes we can run slightly behind schedule with our appointment, like if a patient comes in and urgently needs blood, or we have an urgent add-on for chemotherapy, or if someone has a little bit of a hypersensitivity reaction and the nurses have to go help that patient. But mostly we run on time. We do not double book our appointments. We just want to let you know that. But especially right now, we are running pretty much close on time, and you won't be waiting very long. Okay, so we talked a little bit earlier about the chemotherapy destroying fast-growing cells, and some of those cells are your healthy, fast-growing cells. So let's talk a little bit about that. Some of your more important, healthy, fast-growing cells are the cells of your bone marrow, your white blood cells, your red blood cells, and your platelets. Your red blood cells are the cells that carry oxygen out to your body. So you can imagine if you get low on your red blood cells, you have side effects like feeling short of breath, or getting winded after a little bit of exertion, or increased fatigue. We call that anemia. When you're low on your red blood cells, the word is anemia. Some of your other fast-growing bone marrow cells are your white blood cells. Your white blood cells are cells that fight infection, so they are very important cells. There's one particular type of white blood cell that we look at, and it's called a neutrophil. The neutrophils are the baby white blood cells that are ready to grow up and fight infection if you were to be exposed to an infection. So they're really important, and we keep close track of those while you're going through treatment. The term for when you're low on your white blood cells is neutropenia, or you might hear us say that you are neutropenic, and that means that you're low on your infection-fighting white blood cells. And we'll talk a lot about that a little bit later in the presentation. Another fast-growing cell is your platelets. Your platelets are what make your blood clot if you were to cut yourself. The fancy term for a platelet is a thrombocyte. So when you're low on your platelets, we call it thrombocytopenia. If you're low on all of the cells of your bone marrow, we call that pancytopenia. I just wanted you to hear those terms so because they will come up during your treatment. That way you know what they mean. Other cells or other labs that we'll be monitoring during your treatment are your kidney function and your liver function. Your kidneys and your liver process a lot of the chemotherapy, so we want to make sure that they're healthy and handling the chemotherapy that we're giving you. In addition, we also monitor the labs that pertain to your particular type of chemotherapy. So for example, some chemotherapies seem to really affect the magnesium. And so for those patients that are getting that protocol, we'll be monitoring your magnesium. Some of the newer treatments, like cytokine therapy treatments, they seem to really affect the thyroid. So even though you don't have a thyroid issue, we're going to be monitoring your thyroid. And the reason why I bring that up is because, like I said, the clinic is an open clinic. And so you might occasionally hear conversations that other patients are having with their nurse or their doctor. And the nurse might talk about monitoring the magnesium or monitoring the thyroid. And you might think to yourself, well, how come they're not monitoring my magnesium? How come they're not checking my thyroid? Did they miss something? No, it's just that, like I said, every chemotherapy protocol is individualized for every patient. And so we're just monitoring those labs that are most affected by the chemotherapy that you are getting. Now for a minute here, I would like to talk a little bit about home safety. Your body starts processing the chemotherapy right away when we put it in your body. And then your body starts to get rid of it, the parts that it didn't use, is excreted in all of your bodily fluids, your sweat, your urine, your intimate sexual fluids. This process chemotherapy isn't exactly the same as when we put it in your body, but we still don't want people exposed to large amounts of these bodily fluids while your body is processing it. It takes about 48 hours after your treatment ends for the body to clear out the chemotherapy. So during those 48 hours, we need you to take extra precautions to prevent other people from being exposed. In your binder, you'll find a very thorough list of the things that you can do to stay safe when you're on chemotherapy and you're at home. They have really practical guidelines, and it covers a lot. So if you could make sure that you look at that page so you know how to stay safe at home, that would be helpful for you and for your loved ones. It is a good idea to have a box of gloves at home in case you or someone else needs to handle linens or clothes or towels that have come in contact with bodily fluids during those 48 hours. And of course, everyone taking chemotherapy must be using a reliable form of birth control. And in addition to that, any male partners need to be wearing a condom during sexual intimacy during those 48 hours. So make sure you have condoms at home as well. And finally, there are two groups that we really don't want exposed to this process chemotherapy during the 48 hours, and that is pregnant women and newborn babies. So if you're lucky enough to have a pregnant woman in your life, she shouldn't be the one that's handling the laundry or handling trash that has come in contact with bodily fluids. Like, for example, if you were to get really sweaty one night and your sheets kind of get saturated with sweat and it's during that 48-hour period, she's not the one that should be handling those linens. And anyone else that handles the linens really should be wearing gloves to protect themselves. So make sure you review that handout in your binder so that you know the guidelines that you need to put in place at your home to keep everybody safe. And it also talks about like how to share a bathroom and how to handle the laundry and the trash. And we don't want you to get too worried about this, but just use common sense that no one else needs to be exposed to that. All right, let's talk about side effects. A lot of people have a lot of concerns about side effects going into their treatment. And like I mentioned earlier, we have a lot of new medications to handle side effects. I know one of the big ones that people usually associate with chemotherapy is nausea. You know, when I first started my oncology nursing career, which was a long time ago, we really didn't have that many effective medications for nausea. We had about one or two. And if those didn't work, we honestly would just try to knock people out and let them sleep through it. But now we have not one, not two, but 3 medications that we give on almost every patient before they even start their treatment. And one of those medications even lasts for 72 hours. So we have a lot of medications to handle nausea. We have ways to handle all of these side effects as long as you're communicating with us and telling us that you're having them and what you need to feel better. When you get some of these side effects, if you do, it's important that you let your oncology doctor's office know early on. For example, mouth sores are a common side effect. We would want you to call your oncology doctor's office just when you have one mouth sore and not ignore it and wait until you had many mouth sores. Also, sometimes patients feel like, well, I'm coming into my appointment later on this week, and so I'll just wait and I'll just tell the nurses at Infusion when I get there. What that will do is it will really slow down your appointment, and you'll be at Infusion longer because we're not going to give you your treatment until we get a plan in place for managing whatever side effect it is. So what we'd really like you to do is actually just take the time to call your oncology doctor's nurse so she can triage your symptoms before you can come in. All of our oncology doctors, nurses are really skilled in making plans of care. They know what to do when you call in with a side effect. So just communicate with us and don't delay in letting us know. So one of the big things that we are concerned about on our side is infection. Like I said, your white blood cells will go down during your treatment. This is normal, it's expected. And it happens with chemotherapy, so we're monitoring it very closely when we draw your labs. But there's things that you can do to decrease your risk of infection, so we're going to talk about those now. One of the good things that has come out of the coronavirus, the COVID-19 pandemic that we're having right now, is that people are focused on washing their hands. And that is the #1 way to prevent infection, is thorough and effective hand washing. Unfortunately, a lot of times we just kind of rinse our hands and we don't really wash our hands. So on your screen, there's the 6 steps of appropriate hand washing, and I'm going to walk through them with you. The first one is to get your hands wet, but then take them out from underneath the water. You're going to put a good amount of soap on your hands, enough to lather it up for all the surfaces of your hands for about 20 seconds. And when you do wash your hands, make sure that you wash the palms of your hands and then the back of your hands, in between your fingers, and then that little webby part that's in between your thumb, like right next to your thumb. Also, you can bend your fingers and kind of scrub them in the middle of your hand so you're getting your nails. And then don't forget to wash up your wrist also. And that is thorough and effective hand washing. And then put it underneath the sink and wash the soap away. And that should take about 20 minutes, or excuse me, it should take 20 seconds. It might feel like 20 minutes though, because we're so used to washing our hands so quickly. People also ask about hand sanitizer. Hand sanitizer is fabulous. It's really effective. Some studies shows that it's more effective than washing your hands because people actually do it. But the same principles apply. When you use hand sanitizer, you need to put enough in your hand that you can wet all the surfaces of your hand before it starts to dry. So if you just put a little tiny bit of hand sanitizer in your hand and rub your palms together, that's not going to be effective at preventing infection. But if you give yourself a good amount of hand sanitizer so that you can get all the surfaces in between your fingers, the back of your hand, up your wrist, wet, and then let it dry, that's effective hand sanitization. So go ahead and use that hand sanitizer, put it in your purse, put it in your car, put it in your truck, use it after you're in public places, and that will help prevent infection. And then there is a picture of on your screen about people wearing masks. And I used to just have to tell people that if their white blood cells got so low that they were at high risk for infection, then we would be asking them to wear a mask. But these days in this current climate, everyone is wearing a mask, and it is an effective way to prevent infection. So definitely wear those masks. One more thing is that not only you, but everyone in your household needs to learn how to do effective hand washing so they're not bringing germs home with them. So please review that slide with all the people in your house, and you can tell them the nurse said. So just blame it on me, and you can say the nurse said this is how we all need to be washing our hands to prevent infection. Other infections that we worry about during chemotherapy are the vector-borne infections like Lyme's disease and West Nile. So when you're outside, and I hope you are being able to get outside, please protect yourself against mosquito bites and tick bites. Use all of the precautions. There's several listed in your binder about how to prevent those vector-borne illnesses. It is a really serious issue if someone gets one of those vector-borne illnesses while their white blood cells are low and their immune system is suppressed. So please take those precautions, and don't forget to check your pets also if you take pets with you. Another way that people can get infections is by foodborne illness. And it seems like every year during the summer we start to hear about like the listeria that is on cantaloupe and other E. coli and other foodborne illnesses. So there's a couple of rules about the food that you eat during your chemotherapy treatments to prevent illness, and then we're going to talk a little bit about some generalizations about what to eat. So the rules are no raw fish and no rare meats during your chemotherapy treatment. So if you're a big sushi fan, you need to go get some sushi now, but not have the sushi that has the raw fish in it during your treatments. And if you're like me, I like my steak still mooing when I eat it, but not during chemotherapy treatment. It definitely needs to be cooked to those safety degrees when you're eating. So as you can see, eating out or eating at buffets or eating at deli bars would increase your risk of infection because those foods, we don't know how they're stored. There's lots of people handling those foods, lots of people around those foods. So those would not be the best things to eat during your chemotherapy treatment. It increases the risk of your foodborne illness, and we're trying to do everything we can to decrease your risk. And right now, people aren't really, I'm not even sure if the shops are open, the sandwich shops, but I think a lot of places like this are opening back up, but those would still not be the best places for you to eat during your treatment, just to prevent those foodborne illnesses. Other ways that you prevent foodborne illness is by washing your fruits and your vegetables before you eat them. And yes, we definitely want you eating fruits and vegetables. There's still like an old wives' tale out there that says to not eat fresh fruits and vegetables when you're going through chemotherapy, and that is entirely inaccurate. We do want you eating the fresh fruits and vegetables, and you can have salad. The key, though, is that we want you to thoroughly wash your fruits and vegetables before you eat them. So for example, the cantaloupe. You probably don't normally wash a cantaloupe before you cut it, but while you're going through chemotherapy treatments, we would want you to wash the outside of that cantaloupe before you cut it, because if there were germs on the outside of the cantaloupe, then when you cut it, now you've dragged them into the part that you're going to eat. Same with apples and oranges, everything that you're going to eat, we want it washed. And if you're going to have a salad, for example, maybe usually you just do a quick dunk in the sink, but now when you're going through treatment, we want you taking each individual leaf and washing it in the sink and making sure that every part of it is washed before you make your salad. So that's how to decrease your risk of foodborne illnesses. And now let's just talk about what to eat in general. So your body is working really hard for you right now. And you might feel like, I'm not working very hard. I just come in and I sit down in my infusion therapy chair and I stick out my arm for 4 hours and then I get up and I go home. But your body is working so hard for you. Your body is destroying cells. Your body is building new cells. Your body is filtering all this chemotherapy that we're giving you. It's working hard for you. And an example that I like to use is a high-powered race car. If you have a high-powered, finely tuned race car and you give it lousy gasoline, it will still run, it will still function, but it's not going to be performing optimally. And your body is more finely tuned and high-powered and complex, more than a race car. And so this is the time to be giving it the absolute best fuel possible that you can. And that means the best types of protein that you can afford. High quality proteins, whole foods, nutrient dense foods, bone broths, lots of fruits and vegetables. And this isn't the time to be fueling your body with what we call empty calories. So that would be like sugar and soda and processed foods, because you're not going to get a lot of nutrients out of them. And nutrients is definitely what your body needs right now. Now, having said that, because chemotherapy can alter your taste and alter your taste buds and sometimes decrease your appetite, sometimes there are days when the only thing that sounds good is a Big Al's milkshake and fries. You know what? Go ahead and eat the Big Al's milkshake and fries if that's what sounds good that day. But overall, we want you eating the nutrient-dense food as much as you possibly can. Just another note on that. If you are getting radiation treatment to your abdomen area, they will have some different guidelines for food for you, and their guidelines trump my guidelines. Just follow what their guidelines if you're getting radiation. But everybody else, eat those fruits and vegetables, eat that nutrient-dense food. So we've talked a little bit about infection, and you might be wondering, how do I know if I have an infection? It's everything that our grandmothers taught us, right? Biggest thing is a fever. And some chemotherapies can cause a low-grade fever. So less than 100, we're not too worried about that. But your magic number is 100.5. So if you have a fever of 100.5, not 105, but 100.5, or you've got the chills and sweats that come like with the flu, that's definitely a sign of an infection. And we need to find out where that infection is, and we need to treat it. Also for your respiratory system, cough, new mucus production, new shortness of breath or painful breathing. For your skin, or for your mouth, soreness of your mouth, sore throat, white patches in your mouth. Urinary tract infections present as pain or burning with urination. Strong odor or frequency, needing to go to the bathroom frequently, but nothing comes out. Those are all signs of a urinary tract infection. For your skin, especially around your port site, any redness, tenderness, puffiness, pussiness, all of those would be signs of a skin infection. So then you're asking, well, what do I do if I have these symptoms? Oh, excuse me, let me go back. All of these are signs that there is an infection somewhere, and especially in a neutropenic patient, that is a medical emergency. So first thing we need you to do is to notify your physician. And if it's during regular office hours, you can just give them a call. Like I said earlier, all of the RNs that work there are very good at triaging. That means figuring out a plan of care for the symptoms that you have. However, if it's outside of normal office hours, the best thing for you to do is to go to the emergency room. And I know you probably don't want to hear that, but the truth is that you could call your physician anytime, day or night. In the middle of the night, we still have an Enloe oncology physician on call. We don't outsource our calls. It would be an Enloe oncology doctor. But if you call in the middle of the night and say, I have 102-degree fever, and plus my mucus that I'm coughing up has changed color, and I have a sore throat, that doctor is going to tell you to go to the emergency room, because that is the safest place for you right then. The emergency room knows what kind of cultures to draw. They know what kind of antibiotics to get you started on. They know how to locate that infection. And that is the most important thing to do, is to locate the infection and get it treated. So if you have these symptoms and it's outside of normal office hours, go ahead and get yourself over to the emergency room and they will take care of you. So at this point in the presentation, we usually stop for some questions. If you do have any questions, let's just take a minute and let you write them down. All right, on to the good stuff. Things that you can do to make yourself feel better. The first thing, the most important thing, is to be well hydrated. Hydration makes everything better, and dehydration makes everything worse. The goal that we want for you is 96 fluid ounces a day of hydrating fluids. And it doesn't have to just be water. There are other fluids that are hydrating, like milk, if you can handle the lactose, juice, if you can handle the sugar. My favorite one is broth. Broth is mostly water, and it's very nutrient dense, and it's good for your gut. You can have popsicles, yogurt. There's lots of hydrating, other ways to get your hydration in. And I need to correct myself. I said 96 fluid ounces of water. It's 64 fluid ounces. That's a lot easier to manage. But still, that can be quite a bit for people. And so we've got some suggestions for you on how to get that hydrating fluid into you. The first thing is make sure you start early in the morning. There's nothing worse than starting your hydration in the afternoon and then having to be up all night peeing because you put so much fluid in you at the end of the day. So you can, some people will fill up a pitcher of water or other hydrating fluid at the beginning of the day, and they know that, you know, halfway through the day, they need to be halfway done with that amount of water or other fluids. And, you know, by 4 o'clock, you should be all the way done so that you have some time to urinate it out before you go to bed, because we do want you to sleep at night and not be up all night peeing. When you're well hydrated, it helps your kidneys to process the chemotherapy. So that's one very important benefit of staying well hydrated. People often ask about the other fluids that are really popular in our society, like coffee and soda. Well, the truth is, we know that if we made you choose between your coffee and your chemotherapy, you would probably choose coffee, and then we would all be out of a job. So you can have coffee, you can even have soda if you have to. We'd like you to minimize those fluids because they are dehydrating. And if you are going to have those fluids, then you just need to add on a little bit of extra hydration. So if you have like a morning cup of coffee, then just add on an extra glass of water that day. Alcohol is an entirely different story. Alcohol is a very dehydrating fluid, and the oncology doctors don't like people to have alcohol during treatment, also because it affects your liver enzymes. So if you are a person that regularly drinks alcohol, make sure you bring that up with your oncology doctor so you can get some guidance about that. Other than that, just keep track of that hydrating fluid because it will help you in so many ways. And when people get dehydrated, it tends to make all of their side effects worse. The lining of your mouth is a fast-growing cell, and so it also will be impacted by the chemotherapy. Sometimes people can get a tender mouth or mouth sores or taste alterations. Their mouth can feel dry, and they might not make as much saliva, which is a really important part of your oral health, is to have enough saliva. There's lots of things that we can do to treat that, and we don't want you to overlook it even though it may seem like a small thing. But one of the things that we have people do is to start some prevention of mouth sores even before they start their chemotherapy, maybe like a day before your chemotherapy. If you could start doing an oral rinse with baking soda, salt, and warm water. It's very simple. It's so simple that sometimes people think it won't make that big of a difference, but it really is effective in preventing mouth sores. So it's just a teaspoon of baking soda, a teaspoon of salt in a cup of warm water. Mix it all together, and then swish it around in your mouth and spit it out. We don't want you to swallow it. This is one that you spit out, and you just use that whole entire cup of water, rinsing and spitting. We'll have you do this about 3 times a day to start. You can do it more. If it feels good, it's not going to hurt you. If you're doing the oral rinse and you still get a mouth sore, please let us know. There's lots of other treatments that we can give you to help with any problems that show up in your mouth. Also, make sure that you're using a soft toothbrush, and we don't want you using an alcohol-based mouthwash right now because the alcohol can be drying to the tissues. Just start that oral rinse. Also, make sure that you've let your dentist know that you're starting treatment too. Sometimes the dentist will be able to get you in for a cleaning or a fluoride treatment even before you start chemotherapy. We don't want people having a lot of dental work done while they're on treatment because of that low white blood cell. If you have any other questions, there is a whole page in your binder about how to take care of your mouth. Rest and exercise. Some of us have a hard time balancing rest and exercise even right now in our life, and it's even more important that you balance that as you go through treatment. We do want you resting at night. There's a lot of important things that happen when you rest at night, so please establish a bedtime routine. There's lots of tips on the internet about how to get good sleep. Those would be important to look at, and if you're not resting at night, make sure that you let us know so we can see if there's anything that we can do to help you. It's equally as important to keep on moving. Fatigue is a very common side effect of chemotherapy, and we talked about that a little earlier when I was explaining how hard the body is working for you right now. So most patients have some degree of fatigue. It's very individual to each patient, but we do want you to keep moving. If you are someone who exercises a lot, we want you to be able to keep exercising. You might not be able to do as much exercise as you do right now, but we want you to keep exercising. The key, though, is to stop before you get tired. With your body working so hard, it just doesn't have the reserves to bounce back after a really hard workout. So the key, like I said, is to stop before you get tired. One of the examples I have of this is I had a patient who had a very large lawn, and the lawn was really, really important to him because we do tell people, pick what's important to you, focus on those things, and let other people do the other things that aren't as important to you. So for this patient, his lawn was really important to him. And he would learn that on the weeks that he didn't have very much fatigue, he could use his riding lawnmower and mow the lawn in one day. On the weeks that he had some fatigue, it would take him 2 days because he would have to stop. And on the weeks that he had the most fatigue, it would take him 3 days to mow his lawn because he learned that he had to stop before he got tired. And that's what we need you to be doing also. If you're not doing any movement at all, we really encourage you to find some kind of movement that you can do. It might be walking, it might be some very gentle restorative yoga, it might be some chair exercises, anything that you can do to keep moving. Because there was a really big nursing study that showed that people who did some movement actually had less fatigue than people who didn't do any kind of movement at all. So make that a priority to keep some movement in your schedule. And finally, chemotherapy makes you more sensitive to the sun. This is not the time of, oh, I'm going to work on my tan kind of sensitive. It's actually a chemical burn that happens on your skin. So we're moving into summer. Please be using all of the suggestions to protect your skin. Appropriate level sunscreen that's reapplied appropriately. The best is long sleeve shirts, sun protective clothing, large hats, and staying out of the sun at those peak sun times. And for some of you snow buffs, I know there's still snow up in the mountains. All of this applies even if you go up to the snow to protect your skin from the sun. We usually have a time for questions, so again, write down your questions. And then we take a tour of our clinic. You can kind of see from the picture there, that's my wonderful colleague, Leslie. And you can see that it's an open clinic and our patient is just sitting in the chair and there's other chairs around her. A couple of things about the clinic that I want you to know about is the first is our slogan is the same as Vegas. So Vegas's famous slogan is, what happens in Vegas stays in Vegas. And that's the same for infusion therapy. What you see at infusion therapy needs to stay at infusion therapy. You might see some of your neighbors or some of your coworkers being treated here at infusion therapy, and maybe they haven't shared the diagnosis or the fact that they're getting treated. And just like you would like your personal health care information protected and respected, we ask that you protect and respect other people's healthcare information. And also I want you to know that not everybody that is at infusion therapy has cancer. The vast majority of the people that we treat at infusion therapy are there for treatment of their cancer, but we actually do anything that needs to get into people's veins. So for example, a pregnant woman might be there because she's vomiting too much and we're giving her hydrating fluids. Or someone could have had a knee surgery and gotten an infection and they need antibiotics, we take care of them too. Or some people are chronically low on their iron or have an immune deficiency and they need a medication every month. Yep, we do that also. Crohn's disease, irritable bowel syndrome, colitis, there's a lot of things that we do. So just because you see someone there doesn't mean that they have cancer. But regardless of why they're there, please keep that information private. So this is the end of my presentation, but it's just the beginning of your journey through this season. I love this quote about visualizing yourself becoming healthy and moving forward. It is a tough season of life, but we're here for you. We'll get you through it. Let us know what you need. Let us know how we can help you because we are your oncology team. Thanks so much for watching this presentation.
Right, you're good there.
There we go.
And then we're going to do this.